Hi everyone. Previously I covered the null hypothesis versus the alternative hypothesis and their relationship to p-value and alpha. And the reason was to determine how significant were the results from a study. So today we're going to go over the confidence interval to see how they play a role in interpreting the data. So confidence interval, they're basically gives us the same information as a p-value to alpha would. So what they do is that they tell us how significant the results are. So basically, if we have a study, usually in a study, there is confidence intervals and there are the p-value and alpha. And comparing the p-value to alpha, we can tell if the results are significant. But let's say you're taking an examination or you come across a study that doesn't have a p-value. Usually they do, but let's say there is not. Then confidence interval can be used to interpret the data and see if the results are actually significant. So the way it works, basically, confidence, I'm going to refer to confidence intervals as CI, is basically 1 minus alpha. And in the previous lecture, I did mention that alpha is basically determined by the researchers. And there are two options in this case. One of them is 5% and the other one is 1%. In most of the cases, researchers go with the 5%. So there are two options. Option number one would be 5%. Option number two would be 1%. So let's look into this. Going back to the previous lecture, we said that when we have a normal distribution curve, right, the 5% is basically, so we have over here, it's basically the tails. So let's see, so we have over here a normal distribution, this is one standard deviation, and then over here is another one standard deviation. And of course, I mentioned that this would be the mean over here. And then over here, it would be 2 standard deviation. So this is 2 standard deviation. And this is all from the previous lecture. And we said that 1 standard deviation is basically 68%. So 34% over here and 34% on the side. And 2 standard deviation is basically 95%. So from here all the way to here is 95%, right? So this is where it comes into 5%. So basically alpha is over here and on each side, and in each side is basically 2.5% in this case. This is what we're gonna see in most of the cases. There are some cases where we're gonna see the 1%, which means that 99%, which is covered by the, let's take another pen, by the third. So over here, this would be a third standard deviation. So this is third standard deviation, third standard deviation, and 1% means it's 99% confidence interval, or that's what we're looking for, which is covered by third standard deviation. So knowing this, basically alpha, it's not going to be here, it's going to be all the way. If we're going with the 1%, it's going to be over here. So alpha, instead of being covered by, instead of being here, it's going to be basically over here. It's going to move more to the left and here more to the right if we had 1%. But if we had the 5%, then we'd have a 95% confidence interval, and it's going to be from here all the way to here and from here all the way to here, which is 2.5 in each side. So we know that alpha is determined by the researcher, right? So from here we can tell that there is a 95% confidence interval, which means is that the researcher, basically, they are 95% confident with a confidence interval sure the results are correct. And in this case, what we have to show that it's significant, from the previous lecture, I did say that the p-value, so p-value, if it's less than alpha, right? And alpha in this case is 5%, and basically 5% in this case, this is basically 0.05, right? That's 5%. And here it's going to be 0.01. So if p-value is less than 0.05, we said this is statistical significant. Okay? And if we have a p-value that is equal or larger than 0.05, this means it's not. So this is not. Here it is. Statistical significance. Here it's not statistical significant. So we know this. This is from previous lecture. Okay? And that's how it comes around to interpreting the p-value to alpha. So this one over here, this is basically alpha in both cases. So now we know this, okay? And we know that the 95% is basically how confident the researcher are. And knowing that we have this confidence interval, when we have a result, okay, when it comes into result, there are two ways the confidence interval range can be determined or can be interpreted depending on the result. So if the result is basically, if we have a narrow range of confidence interval, so let's say we have let's take an example. So we're taking this example over here, and we say we have a study that in the study we have 500 individuals. So this is, let me make it like this. So we have individuals is 500. And basically in this example, in this study, we're having a drug or a medication, and we have 500 in this is a drug group or medication group. And we have in versus placebo, which is another N 500 as well. So the number of patients are 500 in each one of the groups, right? And what the researcher did, they said that we want the alpha to be 5%, which is basically 0.05, right? This is where we just learned from here. This means that the researcher, they are 95% confidence, just like I said, that if the result are accurate, okay, they're 95% that what they have in the study, their results are accurate. So from here, basically, if let's say we have a let's say we have a difference, okay, in the means between the two groups. Let's say it's basically 10%, okay? So the difference, which is in means, difference in mean, difference in mean is basically 10%. So what we can say is that 10%, 95% confidence interval with the range, okay, it would be 2 to, let's say, 75%. 2% to 75%, right? Or actually, let's just make it 2 to 75. 2 to 75. So we have this range, first of all. This is the first range. And then there is another study, okay? They did the same thing, and we have 10%. They did the same exact thing. 95%. Or let's say this is just the same study. The first time we had it like this. And when they redid the study, we have confidence interval. That is, let's say 2 to 10 instead of 75. So looking at these two data points over here, or the ranges between the, so this is just, let's make another. In comparison between the two, we're saying here we have 95%. The researchers are confident that their value or their accuracy is basically between 2 to 75. Here we're saying it's 2 to 10. The reason why I'm trying to mention this, it's because the narrower, how narrow is the range, that's the better. It means that the researchers are more precise in terms of the results. So there is, when we have this narrow confidence interval range, it means that the researchers, they're basically confident that it's going to happen between 2 to 10. However, if we have 2 to 75, it's really a long range. So it's going to be, they're not going to be as precise as 2 to 10. So that's the difference in between different data points when it comes into confidence interval when we're interpreting these data. Because the narrower, the better, of course, and we have a better result when it comes into interpretation of these data and applying this medication to majority of patients. Because over here it can be from 2 to 75, we're not sure. Here it's 2 to 10, it's easier, it's more precise. So now that I have covered this, let's see how can we interpret the confidence interval. So confidence interval, they can be interpreted in two ways, really depending on what the study is using to calculate the results. It all depends on what the statistical methods are being used. So the first one, we're having comparing differences data. If we're comparing the differences, and when I say differences, it means means. Whenever you hear the word difference, always think about the means. So basically the study is using the mean between the medication and the placebo, or medication and another medication that is already in the market, and they're comparing the two. So we can interpret the confidence intervals through the difference in the data, and that's the mean. So when I say the difference, whenever you hear that, always remember this is associated with 0. Or 0. Whenever you hear means, it's always associated with 0. Okay? And I'm gonna come and explain what does that mean. So let's take an example to better understand what this means. So in this example, I have gabapentin versus a placebo. And what we're trying to do is basically we're trying to compare the two in terms of side effect. So first side effect, we have weight change. We know that gabapentin can increase weight. And we have a dizziness, okay? And in each group, in this study, we have 350 in each one of them. And the researcher, they're picking up, basically they determined alpha to be 5%. Therefore, confidence interval is 95%. That's what it means. So this number, I came up with them just to make the explanation really easy and to learn how to interpret the data when we have no p-values. So when there is no p-values, that's when confidence, like I mentioned, confidence interval comes into place to interpret the data and come up with the conclusion to see if it's actually statistical significant or not. So let's look at this first. So we have over here weight change is plus 1.6 kilograms. So basically what happened when they took gabapentin, their weight, patients, individuals who participated in the study, increased by 1.6 kilogram. In placebo, increased by 2.3 kilograms. So obviously placebo increased way more than the gabapentin. Now we're trying to see, is it statistical significant? Was that significant to determine that this has caused way more than this? So we're going to look at the difference, and I say difference because it's means. We're comparing the means. So here what we're going to do, step number one, whenever we're having these, the means of each, the medication, the drug, gabapentin, and the placebo, step number one is to subtract. So subtracting this from this. And that's where negative 0.7 comes. So basically where this, so what I did is basically 1.6 minus 2.3, and that's negative 0.7. That's where negative 0.7 comes in. And I just plugged in this range of confidence interval just to make the interpretation easier. So what we have over here, we have negative 2.2 to negative 0.5. So always remember, this is very important, this is what I want you to remember, is when it comes into interpretation of or comparing the differences, which are the means between the two groups, we want to keep in mind the zero. Why the zero is super important in this case? It's really important because if the range, okay, include zero, if this range does include zero, it means it's not statistical significant. Mean the comparison between the two is not significant. So the gabapentin would not be better than the placebo in this case. It would not be statistical significant if it does include the range 0. So here we see negative 2.2 to negative 0.5. So let's draw this over here to better understand. So we have the mean. So we said this is the mean, right? So this would be the mean over here in the middle. So in this case, we have the mean 0, negative 0.7. So this would be negative 0.7. This is the mean, okay? The range is basically negative 2.2. So if this is negative 0.7, so negative 2.2, it's going to be somewhere down here. So negative 2.2. And then we have negative 0.5. So if this is negative 0.7, then 0.5, it's going to be somewhere down here. So negative 0.5. This means that 0 is not really included in this. So because we went from here to here, 0 does not come into between these two range, between this range. 0 is not included. So if I were to have a 0, it's going to be somewhere down. So if this is negative 0.5, so it's going to go to all the way to 0. So it's going to be somewhere down here. This is where 0 is. And 0 is not included. This means that this is a statistical significance. So what I mean by that is basically the weight increases by gabapentin. It did increase for patient, but in comparison to the placebo, it was less. And it's significant because it did not increase the weight as much as the placebo. Placebo could be another medication on the market. So, and gabapentin could be another medication that the researchers are developing. So, to make it better than the one that is in the market. So there is already a medication in the market that is used for pain and neuropathic pain. And where we have another medication that the researcher are developing to treat the same condition, and they're claiming that their medication actually does a better job when it comes into weight increase. It doesn't increase the weight as much as the medication that exists on the market, or it could be a placebo. So either one of them would have the same conclusion in this case, because it did not include zero. And in this case would be statistical, so statistical significant. Actually, let's make this right. I'm just gonna say statistical significant. That's all. So that's what it is. Now, why did I include zero? So why did I say zero? Why does zero is associated with the means? Why not number one? Why not number two? Why not negative 10, let's say? Why zero? Okay, why do we use zero? Well, here is the reason why. It's because when we're including the means, we're saying it's comparing the difference. And when I say the difference, we're subtracting, right? So we are subtracting the means from the medication and the mean from the placebo. So it's a subtracting. And imagine if we had, let's take an example. If we had an example, instead of here being plus 0.3, if it was 1.6, so we had 1.6 from the gabapentin medication, and placebo said 1.6, and we know we're subtracting the two. What's going to happen? 1.6 minus 1.6, 0. What this means, basically, there is no difference in between the two. This is the reason why we're using the zero, because if we have the answer as 0, this means there basically no difference between the two groups, which means another way, basically, that the medication the researcher are basically developing, it's not different from the one that already exists in the market or a placebo. So there is really no benefit. This is why we use zero. So if zero was actually included in this range, it would not be considered statistical significant. So let's take another example to better understand what I mean by this. So here we're comparing side effect of dizziness, right? We have number of people, 10 over here, and here we have 15. And I'm trying to see that, of course, makes sense. There is more people with placebo that had dizziness in comparison to gabapentin. Now I'm trying to see, well, is this 15 people comparison to 10, is it statistical significant? So we're gonna draw this over here, and we're gonna see if it does include zero. If it doesn't, then it's gonna have the same conclusion, statistical significant. If it does, then it's not going to be statistical significant. And let me go over here. So basically we have, this is the mean over here, just like I mentioned. So we have the mean. So basically I did the same thing. Let's go step number 1. 10 minus 15. So here we have 10 minus 15 is basically negative 5. That's where this negative 5 came from. So now I have the mean negative 5, right? So I have over here the mean is negative 5. We know this right now. Let's look at the range. Range is negative 7 to 20. So negative 5 is over here. That's mean negative 7, it's going to be somewhere down here. So negative 7 is here. And we have all the way to 20. This is positive. So it's going to go all the way up here. So this is 20. So that's mean this is the range from here to here. Now, as we're going from negative 5 to 20, 0 is somewhere down here. So 1, 2, 3, 0, and then negative 4, negative 3, negative 2, negative 1, and then comes into 0. So let's say 0 is here. This is 0, and then goes 1, 2, all the way to 20. So looking at this range, it does include 0. So there is 0 included. This means the difference in between the two groups is not really statistical significant. So this is not a big difference when it comes into interpretation of statistical data. It's not. And that's how we can interpret the confidence interval when p-value is not it doesn't exist, or it's not that it doesn't exist, it's not included in the study, or in the exam when you're being tested, it's been taken out, and now you have to interpret the data based on these confidence intervals. Another way, going back to the previous lecture, we can look at this. Since it's statistical significant, we can say per the null hypothesis versus alternative hypothesis. Here in this case, in case number one, like the first example, weight change, because it did not include 0, we're going to reject the null hypothesis. The reason why, because remember previous lecture I said null hypothesis says that there is basically no difference between the two medication. However, there is a big difference because the 0 was not included in the range. So here we're going to reject the null hypothesis or accept the alternative hypothesis, which says there is a difference, and we can see there is a difference. On the other hand, basically over here, because we have 0 included, so the null hypothesis, it's going to be accepted. Or the other way it's being used is fail to reject null hypothesis. And the alternative hypothesis will be rejected in this case. Now, let's take the second option when it comes into interpretation of confidence interval. This comes into comparing the ratio data. So here we had difference in data, which is mean. Here we have ratio data. Ratio data can include relative risk, hazard ratio, odd ratio. And this is basically based on division. So here it's based on the difference, so subtracting the mean. Here is based on the division. The division of a ratio, the medication, ratio of medication to another medication that already exists in the market, or ratio of the medication that the researchers are working on to a placebo. So that's what a ratio means, one over the other. That's why it's based on division. So here we're comparing basically a side effect, dizziness, mild to severe, and we have, in terms of the group for the drug or the medication, we have 6,000 individual, 6,000 in the placebo, so we have equal number of individual in each group, and we have a relative risk. So the researcher did the same thing. They picked alpha as 5%, therefore we have 95% confidence interval. And what we have, I picked up also the data just to make it easy for interpretation. This not necessarily it's accurate. This is just something I picked to make it easy to understand. So here we have a ratio of 0.13, and then for a placebo we have 0.15. So how did I get the 0.87? So I did a division. So basically in this case, I did 0.13 divided over 0.15. And the answer is 0.87. Okay, that's where this 0.87 came. So just like the comparing differences data, which was mean was associated with 0, here the comparing ratio data is associated with number 1. So this is associated with number 1. Now, why did we pick number 1 instead of picking 0 or like let's say number 5? Why number 1? Well, the reason is, let's take an example to better understand why number 1. So if we had an example over here, and in case if the drug was 0.13, placebo was also 0.13. So 0.13 dividing by 0.13. Then we know it's the same value, so basically the answer will be number 1 because there is no difference, it's the same value. And this is the reason why number 1 is picked, because whenever I have number 1 basically in the range, this means that the statistical data, it's not significant. So let's look at the dizziness mild between the medication gabapentin and placebo. So here we have 0.87 in the range of 0.5 to 1.5. So here we have 0.87 and we have 0.5. So I'm going to say 0.5 is right here, and 1.5, let's say it's over there. So we have this range over here. Now looking at this, does this include number 1? The answer is yes, it does, because number one would be somewhere down here. Therefore, in comparison between gabapentin and placebo when it comes to mild dizziness is not statistically significant, which means the null hypothesis will be accepted in this case, and the alternative hypothesis will be rejected because it did include number one. And back over here I said if it does include number one from this example is basically not statistical significant. Now, let's take the severe dizziness. So we have 0.79. So here is 0.79. And we have the range of 0.65 to 0.95. So here we have 0.65, 0.95. So we have this range over here, right? And looking at this range, it basically does not include number one because number one would be somewhere down there. So the range does not include number one, which means the null hypothesis in this case will be rejected and the alternative hypothesis would be accepted because there is a statistical significance between the medication gabapentin and the placebo when it comes to severe dizziness. So this is it for this lecture for understanding how to interpret the confidence interval depending on the type of statistical data used in the study. So if you have any question or comments, please leave them in the comments below. And as always, thank you for watching.